Garlic, a pungent bulb of the Allium family, has been prized for thousands of years, not just as a culinary staple but as a medicinal plant. Ancient civilizations from Egypt to Greece used garlic for everything from vitality to protection against disease. Today, modern science has taken up the challenge. Are garlic's health claims folklore, or do they stand up in rigorous research? Let's begin with the compounds that give garlic its distinctive odor and potential health effects. When garlic cloves are crushed or chopped, they produce allicin, a sulfur-containing compound believed to be responsible for many of garlic's biological activities. But, as we will see, not every claim about garlic is equally supported by evidence, and understanding the strength of the science matters. Cardiovascular health, what the evidence shows. One of the most studied areas for garlic is cardiovascular disease risk factors, things like blood pressure, cholesterol, and inflammatory markers that are linked to heart disease risk. A recent systematic review and meta-analysis of clinical trials found that garlic consumption was associated with improvements in key cardiovascular markers. In adults with unfavorable risk profiles, garlic intake significantly improved lipid profiles, glycemic indices, blood pressure, oxidative stress, and inflammatory biomarkers, indicating potential benefits for heart health, especially among those at higher risk of cardiovascular disease. Another large meta-analysis published just this year found that garlic consumption can reduce total cholesterol, triglycerides, and low-density lipoprotein cholesterol, while slightly increasing high-density lipoprotein, effects particularly noticeable in individuals over 50 years old. However, not all reviews are unequivocal. Some earlier systematic reviews and expert summaries have noted that while short-term reductions in cholesterol have been observed, there remains insufficient evidence that garlic leads to long-term clinical outcomes, such as fewer heart attacks or strokes. These reviews also point out that not all studies show consistent benefits, and that study designs, garlic preparations, and dosages vary widely. While garlic often shows modest surrogate improvements, lowering LDL cholesterol or slightly reducing systolic blood pressure, the evidence is not yet strong enough to consider garlic a replacement for established evidence-based medications prescribed for cardiovascular disease. Blood pressure and hypertension. Blood pressure is another area where garlic has received research attention. Several clinical studies have investigated whether garlic supplements or extracts can help people with hypertension, high blood pressure. In some clinical trials, aged garlic extract was found to reduce both systolic and diastolic blood pressure in people with hypertension, though the degree of reduction and consistency of results vary. This suggests potential blood pressure support, but researchers emphasize that garlic should not replace physician-guided blood pressure medications or lifestyle changes. The National Center for Complementary and Integrative Health, part of the U.S. National Institutes of Health, NIH, notes that garlic supplements may reduce blood pressure to a small extent in some people with high blood pressure, but the evidence remains limited and requires more robust studies. Immune system and antimicrobial effects. Garlic has long been touted as an immune booster and natural antimicrobial agent. Biologically active compounds in garlic have demonstrated antibacterial, antiviral, and antifungal activity in laboratory settings, and some experimental evidence suggests garlic may influence immune function. However, according to the NIH's Complementary Health Review, there is very little strong research supporting garlic's impact on preventing or treating common viral or respiratory infections in humans. Limited studies with small sample sizes suggest a possible benefit for cold symptoms, but these findings are far from definitive and require larger, well-controlled trials. Cancer and cancer risk. Dietary patterns rich in allium vegetables, including garlic, have been associated in some observational studies with reduced odds of certain cancers, such as gastric or colorectal cancer. But these associations cannot prove cause and effect. Reviews of the evidence find that data are insufficient to conclude that garlic supplements reduce cancer risk in humans. Some case-control studies suggest potential protective associations, but prospective clinical evidence is limited and inconsistent. For example, research summaries indicate that while high dietary garlic intake may be associated with lower risks of certain cancers in some studies, overall evidence remains limited and not strong enough to make clear recommendations. Thus, garlic should not be viewed as a standalone cancer preventive agent. Metabolic effects and blood sugar. Some research has explored garlic's impact on glucose metabolism and metabolic syndrome components. A systematic review, including multiple human intervention trials, found that garlic consumption could influence fasting blood glucose and lipid control in some participants. However, as with cardiovascular outcomes, results are mixed, and the clinical relevance of these findings for long-term diabetes management is still under investigation. Antioxidant and anti-inflammatory actions. Garlic contains sulfur compounds and other phytochemicals that act as antioxidants. These compounds may help reduce oxidative stress and modulate inflammatory pathways, underlying processes that contribute to many chronic diseases. While this mechanistic research is promising, translating it into clear clinical recommendations requires more long-term human studies. Food versus supplements. What matters? It's important to distinguish between dietary garlic, cloves added to food, and garlic supplements or extracts sold commercially. Clinical trials often use concentrated garlic preparations, and results can vary depending on the form, dose, and duration. Fresh garlic may contain different active compounds or bioavailability than aged extracts or powders used in research. The NIH notes that not all garlic supplements are standardized, and their effects may differ. Safety and limitations. Garlic is generally safe for most people when consumed as part of food. It has been used orally in research studies lasting up to 7 years without major safety issues. However, there are important limitations and potential side effects. Garlic supplements can increase the risk of bleeding, especially when taken with anticoagulant medications like warfarin or aspirin. This is a significant consideration for people preparing for surgery or taking blood thinners. Common side effects include bad breath, body odor, gastrointestinal discomfort, flatulence, and nausea. Some individuals may experience allergic reactions. Safety during pregnancy or breastfeeding at high doses, beyond dietary amounts, is not well established. Finally, because of variability in garlic preparations and study quality, evidence remains mixed for many claimed benefits. Some large reviews find modest lipid-lowering effects in the short term, but limited evidence for sustained clinical benefits like long-term disease prevention. Conclusion. Practical takeaways. Garlic is a fascinating example of a food with both centuries of traditional use and growing scientific interest. High-quality clinical evidence suggests that garlic may modestly improve cardiovascular risk markers such as cholesterol and blood pressure, particularly in at-risk adults. Meta-analyses and systematic reviews also hint at benefits for lipid profiles. But garlic is not a miracle cure. It does not replace proven medications for heart disease, diabetes, or cancer prevention. Its effects vary by preparation, dose, and individual response, and benefits for immune health or cancer risk remain unproven in most human trials. If you choose to incorporate garlic into a healthy diet, whether raw, cooked, or as a supplement, do so with realistic expectations, and, if you have chronic health conditions or take medications, discuss it with a healthcare provider. Garlic's value may lie in being one component of a balanced, nutrient-rich lifestyle that supports long-term health, not a standalone solution. If you found the information in the video useful, please subscribe, like, and comment below in support of our channel, so that we can bring you more information to better your health. Thank you.